Hello, everyone, and welcome to today's Demo Jam from the AppExchange. My name is Jeff Gross. I'm a Salesforce MVP, longtime AppExchange friend and follower and user. I've got with me today my two favorite co-hosts. It's Joshua Hoskins, who's also a Salesforce MVP, and Amanda Nelson from the AppExchange. Say hello, you two.
Hello.
Hi, I'm excited. Another great demo jam. This is my favorite time, so it's going to be fun.
Indeed.
Demo jams are fun. Exactly. We have got today healthcare and life sciences. This is a great bunch today. We've got 6 demos to get through. Not even get through. We're going to enjoy these things. Today's theme, again, is healthcare and life sciences. You can follow along on the Twitter using the hashtag DemoJam. Today's participants include Axtria, Invent360, FormAssembly, RevCult, Interlace Health, and Redox. Now, we've got rules that go with the Demo Jam, and Joshua is here to tell you what they are.
Can't have a demo jam without rules. Okay, folks, every demo jam contestant gets 3 minutes, no more. You can have less if you want, but those 3 minutes can be accompanied by 0 slides. And of course, as always, there's one winner with bragging rights, and they take home this amazing trophy that gets better and better every year. So thanks a lot, Amanda, for enhancing the Demo Jam trophy as we move into our 5th year of doing this.
You mean this one?
Yep, that's
That
it.
is the one. The cover
Only one partner will get this, but you have to vote out there, so it's going to be fun.
Absolutely.
Well,
That's it for the
with
rules.
that, well, good. Then let's kick it off. First off, today we have Axtria. Axtria Sales IQ is a cloud-based sales planning and operations product suite with integrated territory management, segmentation and targeting, multi-channel call planning, incentive compensation, field analytics, and reporting, to just name a few things. It's built on Force.com, and Axtria Sales IQ provides end-to-end sales planning and operations capabilities that help create a bridge from data to intelligent insights to operations. And it enables high-performing teams, large-scale data processing, and AI, machine learning, model execution. To show us everything that this can do, I've got Brindle Shaw. Hey, Brindle, are you out there?
Yep, I'm here. How are you doing?
I am doing well, and you get a chance to start your demo right now. 3 minutes begins now. Good luck.
Well, hello, everyone, and thank you, Salesforce, for this demo opportunity. I'm going to talk about Axtria Sales IQ solution. It's a #1 cloud-based platform for commercial planning and operations, and it is specifically designed for the life science industries. Now, our product has capabilities to empower and to operate end-to-end processes, starting from segmentation targeting to alignment call planning, and finally to incentive compensation management and performance reporting. It's truly end-to-end and it's truly integrated. Let's look at some of the features now. Start with segmentation. So the segmentation features allows our sales operations users to identify the high-value customers in the market using various analytical methods. Our targeting features helps our sales ops users answer resource allocation decisions. So for example, how many engagements should we have with the customers across different segments? Does the sales team have enough capacity to deliver the engagements in the next sales cycle? Our alignment capability, on the other hand, provides a really rich and visual and interactive mapping interface that helps design well-balanced territories to make sure that the sales team can get a maximum customer coverage. Now, let's move on to our brand new feature that we've just released, which is the multi-channel call planning. This feature is very relevant and very important in the COVID times, because it allows our sales operations users to create a multi-channel call plan, which includes personal as well as non-personal channels like emails, phone calls, and virtual meetings. Now, this capabilities allows our users, it will create a call plan which is effective in the field, and at the same time, the engine will create a call plan which is optimized across various channels and various products. And our users can also add the channel preference and channel consent data into the mix if required. After the call plan is generated, we provide really rich interfaces and really rich reports that can be used to analyze the call plan output. And these interfaces can also be used to drive discussions with the brand managers on the brand strategy. Now, once the call plan has been generated and has been finalized, it could be published to the field reps for execution with just one click. The field reps can look at the announcements on the dashboard that the call plan is available. The field reps can look into the call plan, look into the targets, and look into the various channels and suggest changes as required. Just to summarize, our Sales IQ is a really powerful offering that helps commercial organizations make the sales rep very productive by creating the right territories, targeting the right customers to the right channels, and at the same time measuring and rewarding performance of the sales team. Thank you very much.
Wow, you got down there with 2 seconds left, so good job with the demo and the timing. I tell you what I like when I see this. Number one, you talked about rich interfaces and being able to see your data on a map and be able to understand where you're, number one, calling to, who you're calling on, being able to view all of that data in a rich format, and then the call planning to look across multiple channels, to be able to set up that call plan, to be able to understand the effectiveness face-to-face versus email versus calling. You really look like you've got it all together there as far as being able to comprehensively understand how to contact people the right way, and then looking at what's effective, whether it's the first call, second call, and being able to mix it up
Yep.
in a way to be able to really contact them in the right way that they want to be contacted, as well as, I guess I would also tie in there the opt-in, opt-out. So being able to make sure that you're adhering to everything so everybody stays on the level.
That's really important, especially for a life science industry, that adherence part.
Exactly. Well, let's see what Amanda has for an audience question for you today.
Great demo. Thank you so much. The question is, how are you empowering commercial leaders to really accelerate across channels and mitigate the disruption, especially created by the current pandemic?
Sure. So, it can be done by a few ways. Now, first and foremost, as far as channels is concerned, as I just mentioned in my demo, our multi-channel planning capabilities will allow our clients and our users to plan across channel and not only look at face-to-face channel, because in these days it's really hard to reach the doctors and the physicians. Sales reps, it's really hard for sales reps to meet the doctors and face-to-face. So we help it. Our product helps plan across channels. At the same time, our alignment capabilities are really flexible, because when you talk about across channels, it's very important that we have a tool that allows changing alignment really rapidly and doing tests on different kinds of alignments. So our alignment features enables that. And at the same time, our incentive offering allows you to test and simulate different kinds of plans that you might need when you're talking about different channels. And it lets you simulate the outcome of the plans. So those are some of the ways that we enable and empower people to look across channels outside of face-to-face.
Excellent. Bindal, thank you so much for the demo. Appreciate it. Yeah, I'm going to hand it over to Joshua to introduce our next contestant today.
Oh, that pesky mute button. Hey, everyone, I'm back. All right, so next up, we have FormAssembly. So FormAssembly is an easy-to-use yet powerful web form and data collection platform built to help organizations streamline processes and drive business results across multiple industries and use cases. Organizations and brands rely on FormAssembly's highly rated platform, excellent customer service, and uncompromising stance on security and compliance. We've got a host of people, so I'll just say we've got the FormAssembly family here with us today to show us all of that in 3 minutes or less. Who's going to be speaking first?
That will be myself.
Awesome. Over to you. Your 3 minutes starts now. Good luck.
Thanks, Joshua. So today we're going to highlight how FormAssembly can solve common data collection problems in the healthcare industry. Our HIPAA-compliant form builder can be utilized for many use cases, along with a multitude of industries. Today we're going to focus on building a form for a simple use case, collecting registrants for a workplace wellness program, and connecting that data to a campaign in Salesforce. To quickly build a form, we can access one of the ready-made healthcare templates that lives in the template library shown here. However, we want to show you the functionality and ease of our drag and drop form builder. In our example from here, we're already collecting the patient's contact details, which was previously added using our predefined content feature. FormAssembly offers a customizable predefined content library where you can find common groups of fields. This allows us to drop in ready-made and formatted elements to our form, saving time and ensuring continuity in your form building. Now that we have a few basics, we'll arrange the form specifically for this use case. To start, we'll ask each registrant if they have a happy, healthy subscriber number by using a radio button. We can see the radio button completed with a simple yes or no, and can now create a conditional rule that will introduce a new field prompting the registrant to enter said number. We can also validate the subscriber number, ensuring the data collected is in a desired format and eliminating incorrect entries. Healthcare forms often ask for sensitive data. You can also ensure that that data is collected appropriately with our sensitive data field. Next, let's add our wellness program from Salesforce. OSCO will add another piece of predefined content that will include a pre-formatted set of fields, such as a Salesforce dynamic pick list for listing the program names, a program description field, and a hidden Salesforce ID field for a Salesforce campaign. Dynamic pick lists are multiple choice questions that get their lists of choices directly from Salesforce. Values are populated from Salesforce when the form loads, so the choices in your pick list are always up to date. And now that about takes care of building the form. Let's take a deeper dive into how we're handling that data after the form is submitted. With our powerful and flexible connection to Salesforce, we have web to any Salesforce object, custom or standard, and the connection is bidirectional. Also, we can set up email notifications to be sent directly to the admin with an option to attach a copy of the response data as a PDF. Now let's see it all in action. OSCO will quickly complete the patient-facing form, and we'll see the dynamic pick list is pulling our program data, showcasing live choices from our campaign in Salesforce, including the program's description. Once submitted, we can navigate to the campaign in Salesforce and see that our registrant's data has been added as a lead and a campaign member. This information is securely collected and organized with manual labor and paperwork eliminated. This is one of many ways you can securely and simply collect data with FormAssembly.
Is that it?
That is it.
Wow, I was expecting to see more awesome stuff, but the things that you showed were just mind-blowing. The fact that all of that functionality is in one area to let you customize, drag and drop all of these form element components into that one user interface is really amazing. You know, data collection isn't very easy in a lot of different areas in Salesforce, and the ability to extend this form out to your customers and also internally to internal users to be able to do that so easily is just really powerful. So thank you for all of what you showed today. It was really awesome.
Thank you.
Amanda, what questions do we have out there from the audience?
Yeah, our question from the audience on that great demo was, how does FormAssembly ensure that protected health information stays protected?
Great question. So our healthcare customers opt for FormAssembly's Compliance Cloud option because it's an advanced security and compliance measure. This plan is HIPAA compliant and offers advanced security and privacy controls, as you saw in the demo. We can make sure sensitive data stays in the right hands. With these security measures in place, healthcare organizations can maintain compliant and have peace of mind when they use our platform in collecting patients' histories, medical research forms, and more.
Awesome. Thanks a lot for packing all of that stuff into that mini 3-minute demo. Showed a lot. And Jeff, over to you for the next Demo Jam contestant.
Fantastic. Here I am with Interlace Health. Interlace Health focuses on intersecting the convenience of patients want with the data that providers need. This is something all of us can relate to. They digitize the entire patient intake process, making it fast, fluid, and friendly, the 3 Fs that you always want to have. There's no need to print and scan. The forms are generated and managed electronically, and they're fully integrated with electronic health records that these healthcare organizations use. Patients can pre-register from home, reducing the on-site registration to mere seconds. Interlace Health's patient intake solution promotes staff adoption, the patient communications, it improves the quality of care, and it accelerates revenue cycle workflows, which basically, hey, it results in cost savings. So to show us exactly what this does, how it works, I've got Cliff Babbitt and Ellie Silver. Cliff and Ellie, are you there?
We are.
Yes,
hello.
Fantastic. Well, I am anxious to see this because I've not seen your demo before. So your 3 minutes begins now. Good luck.
When Ellie schedules her annual wellness appointment, she automatically receives an email letting her know she has intake forms or consents to complete. Ellie will access and complete her form on her phone.
I have some time right now and I want to get ready for my appointment. From my email, I really easily access the link to get to my form. And I can do that from home to avoid spending time in the waiting room. All right, well, it looks like all my information is here already and everything looks correct. So I can cruise on to the next page. I'll take this opportunity to verify my insurance and add a picture of my insurance card here. So I'll use the camera on my device to snap a quick photo. And I'll continue on. I'm not currently taking any medication, so I'll say no there. I am allergic to latex, so I'll indicate that as well. Fortunately, I haven't been exposed to COVID, so I'll indicate I have not experienced any COVID symptoms. All right, looks like I'm done and I'm ready for my appointment.
Now that Ellie has completed her intake details, she heads over to the office for her appointment. Cliff is a registrar at the practice and will now check the status of the patients coming in for the day.
Great, thanks. On my customized dashboard here, I can see that Ellie's appointment is coming up, and she's already completed her intake form, so that's great. And I also see there's a clinical alert here that I need to check. So I'll go into her visit and see that she's allergic to latex here. I can see the form if I would like, but now I just need to let the nurse know about her allergy and confirm that the exam room's ready and that it's latex free. So everything looks good with her paperwork. Everything's green here. So the nurse just let me know that the exam room is all ready. And let me just check here. It looks like she just texted us. That gave me a notification here that she's in the parking lot and ready to come in. So I go over and I can actually, on the right side of my screen here, send her a pre-configured text message to let her know that she can come to the front desk right now. So I'll go ahead and do that and let her know that she's ready.
Ellie sees her text message, comes into her appointment, and bypasses the waiting room for a smooth, contactless check-in experience.
Right at the line. I was just about to buzz you there, but fantastic. Good job with that. And I tell you what, I know from personal experience what this is. Well, every one of us has experienced this before, and we've not experienced it with the clean, easy way to do it that you've demonstrated today. And honestly, do I want to pick up the pen inside of that health facility? No, not really. Do I want to give them my card so that they can go scan it into a little scanner and put it in there? No. Being able to complete this all at home and before you get in is fantastic. Then the other thing I saw in there was you had to save for later, so you can actually finish it all at once, which maybe it's not even that hard to do, but you can save it for later, come back to it, continue filling it out. When you go in, being able to see the patient's information, have the alert on there, you know which ones have checked in online. I mean, it looks like it's a win-win-win for everybody because now you get the data, the patient is kept safe because, hey, they're sitting out there in their car, as well as that whole idea of, am I here? When is the room ready? And yeah, they're trying to minimize everybody being inside of a building. So, hey, this makes it very convenient. So nice job. I like what you do here, and it really integrates to Salesforce well. So nice job. I need to give it over to Amanda and see what an audience question is for Interlace Health.
Yeah, I was really impressed by that demo as well. And thanks for the great recap too, Jeff. So the question is, what kind of forms can be sent to patients?
Yeah, great question. You know, it goes back to what Jeff was mentioning there. You know, there could be longer forms. You know, with 3 minutes, we did want to show something a little bit more trimmed down, but this could be used for cardiology intake forms, consent forms, or even, you know, clinical trial consent research, you know, forms that need to be signed by a participant. So lots of different things. We specialize in customizing that and integrating that with the communities so that the patient has a smooth experience on their mobile device or laptop, what have you.
Fantastic. Well, I look forward to seeing a lot more hospitals and clinics using your software, because that is that's something I wish for. So good luck to you. Thanks again for the demo today.
Thank you.
All right. Instead of handing it off, I'm going to take the next one on here. Redox is the leading electronic health record interoperability platform in healthcare, and they've recently released an AppExchange product to enable out-of-the-box integration between EHRs and Salesforce Health Cloud. This is really important. With high-quality EHR data inside of the Health Cloud, users can build dozens of use cases and workflows, such as using Health Cloud for appointment reminders, demographic analysis, referral coordination, case management, and a lot more. Installation is as simple as confirming field mapping, setting volume thresholds, and authenticating connectivity. This is what every organization needs now, and you're really simplifying. Well, I haven't seen it yet, but everything here says that we're simplifying that whole process of integrating the data, which is critical to every healthcare organization. So I'm going to turn it over to Matt Ripke. Matt, are you out there?
I'm here. Can you see my screen and hear me all right?
I do, and good luck. Your 3 minutes begins now.
Well, I'm going to start my shot clock here, and this is going to be the most exciting 3 minutes for anyone who is responsible for getting EHR data over to their Salesforce instance. Before I dive into exactly what this product does and show you an interactive demo here, I just want to set the stage with what Redox does. Redox is a company that helps vendors build integration strategies that work regardless of the EHRs that different health systems, clinics, provider groups are operating on. And we do that by taking advantage of 3 levels of configuration that we see at every different site. So there's some event and interface level configuration. There's some vendor specific configurations you'll see between your Epics and your Cerners and your Athenas. But then there's org specific configuration, and anybody who's ever built one of these tools knows that it's tricky to handle the little tiny details that vary as you're building one-to-one integrations. We wanted to make it so that Salesforce users have the ability to have high quality EHR data flowing into the Health Cloud instance and have that integration be reusable and extensible if they make any changes on the EHR set, so that they don't have to go back and constantly be rebuilding. Very quickly, we work with a bunch of different EHRs. So this works across the spectrum, and I'm happy to talk about more of that later. But I'm going to dive into the Redox dashboard, and this shows really what the information will look like after Redox has received it from the EHR and stripped away all of the different variations and customizations that we've seen. We're going to get that message into the Redox data structure. And then from there, we've actually built a set of configurations to Health Cloud that allow us to go into our DevTools and send that message and show you what EHR integration looks like. And so I'm just going to come over here to my Redox package, and I want to confirm that my API limits are where I need them to be. And I've got 105,000 today, so that's probably going to be enough for this demo. And then I want to flash back, and I just want to take a look at my field mapping. And today I'm just going to do a simple new patient. You can see I've got that active. I click into new patient, and the app is actually going to ping to see if Health Cloud's there. It is. So it's going to auto load the configuration. So I've got my destination parent objects, and I'm going to come into the actual patient level fields. I can set my write permissions, so I can write when empty. I can continuously overwrite with new information, or I can adjust to a field level filter. And I actually, you can see we've already mapped to Health Cloud, but I can add out and split to different field mappings. And so it does give you the ability for some customization, custom objects, if you want to change around fields. We've tried to make it easy for you admins to be able to snap and go here, but we do want to give you that ability to customize. And so if I come over here to my DevTools, I'm going to go in and, yep, I'm coming. Here we come, down to the stretch, going to hit the post. Here we go, the patient admin, new patient. I come down here, I pick Timothy, I pick Pat Granite. I want to go ahead and I want to make it something that I can identify here. So we're going to go with John Dangerfield Smithson. And I'm going to send that model. And for those of you watching at home, I just accomplished EHR integration into Salesforce in 3 minutes.
Right at the mark. So impressive. So I mean, just even seeing the number of EHRs that you work with there was impressive because honestly, I didn't know there were that many of them out there, but that makes it much more challenging for every organization to be able to integrate that data. And you've been able to pull it in there, do the mapping, do everything as far as, do I want to overwrite it? Do I want to duplicate it? You know, all of those different options in there. So number one, that's making the moving of the data much more simple. And you did it in 3 minutes, which is impressive. I think back to, you know, so many times when, okay, well, let's talk about the data integration process. That's going to be about 3-4 months and we'll get you that started. Doing it in 3 minutes is pretty impressive.
Yeah, we're really excited about stepping back into the Ohana here with this new line of AppExchange products and then our MuleSoft offering as well. You know, this is something that's going to work across the spectrum, all ONC certified EHRs and all data types. And so, you know, we're really excited about what this is going to do for the admin community and the SEs who are building really cool workflows in Health Cloud.
Excellent. So you just even dropped there that it was not just the, hey, we can connect this way, but you also got a MuleSoft offering. So awesome. I like to hear that.
Well, thanks,
Amanda.
Jeff.
What? Yeah, absolutely. Amanda, what do we have as a question for Matt?
I think that the question kind of dovetails nicely to what Matt was just talking about. The question is, can this be used with any electronic health record?
Yeah, and that's really Redox's brand promise, is that we're going to be vendor and standard agnostic to be able to provide the data exchange in the format and frequency that you're looking for as a user. So this works with all ONC certified EHRs. We've got just north of 50 today. If there's anything that's not on our list, we're happy to evaluate it. We're adding new EHRs all the time to the standard model of operating. So thanks again, Amanda and Jeff, and we're excited about this.
Absolutely. So thank you so much, Matt. Great job today on the demo. Glad that you're in the AppExchange. All right, Joshua, I'm going to hand it over to you for our next contestant.
Sure. Thanks a lot, Jeff. So next up, we have RevCult. RevCult provides simple security solutions for Salesforce that keep patient data private and safe. Their Who Sees What Explorer enables admins to easily implement, manage, and improve user access controls, operationalize security, facilitate compliance reporting, and quickly prepare for your next audit with their cloud security cockpit powered by RevCult. We've got Devin with us today, and Devin's going to show us how to do that in 3 minutes or less. Are you out there, Devin?
Yep.
Awesome. Hey, how are you? Sir, your 3 minutes starts now. Over to you.
Hi, this is Laura. We're going to do, thanks for having us. We're going to do a little role playing to illustrate our solution. Hey, Devin, I hear you're my Salesforce admin. I'm the CISO of our hospital. We have a problem. The paparazzi are all over the place. Somebody leaked, we think it might have been an intern, leaked that Taylor Z. Swift is here to have a baby. Oh my gosh, and we have a HIPAA audit coming up next week. Can you help?
Yes, of course. Absolutely. So here, let me hop into the Salesforce setup menu and let's look at all the users and their permissions and who has access to Taylor's record here.
Oh, wait a
so I'm
second.
going to open each user.
Directly from her record?
No, we cannot look at who has access directly from her record. So I'm just going to open each user here and investigate each of their assigned permission sets, roles, and profiles, and we'll be able to see why they have access to this specific record. So just give me one moment. I'll just open all these permission sets in different tabs.
One at a time? It's too slow. There's got to be a faster way. Can we speed this up?
Actually, I'm glad you pointed that out. There indeed is a faster way. We just licensed the RevCult Cloud Security Cockpit, which includes the Who Sees What Explorer, where we can view user permissions through a few different lenses. So let's take a look at the patient object here. We're now on the left side, we can see all of the users who have access to this object. And now let's filter by our interns, since that's what we need to investigate first. And all of this is driven by data classification. So that now we'll quickly look at the sensitive information that the interns have access to, filter by high risk here. And we can drill in and we see that Elizabeth and Isaac have read and edit access to all of these fields. And for each field, it's going to show the specific reason why.
Fix it, please.
Okay, here, great point. Now I'll just take this quick link directly into setup. And Elizabeth and Isaac do not need these permission sets assigned in order to perform their job. So we'll remove this so that we're implementing the principle of least privilege and we can prove it with our RevCult solutions. So now we'll remove access since the interns do not need access to patient data. And now when we come back to the RevCult who sees what explore, we'll confirm that this has worked as we refresh here.
Okay, we've got to make sure that they can't see this. I'm very concerned about our HIPAA audit coming up next week. We can use
and
HIPAA audit, right?
Absolutely. And for HIPAA audit, we have a lightning component where we can drag it on the record itself. So I know I said that we couldn't actually show it on the record, but we can. So here we can see all of the users with this RevCult lightning component for the Security Access Explorer and the reason that they have access to this record here.
All right, thanks a lot, RevCult. Just in there at 3 minutes. So what I can see about your solution is it really saved the day. What's there not to say? What I liked about this, is that you were able to open a user interface from a record perspective and understand who sees what. And it was all at your fingertips. And a lot of times what you're mentioning is in Salesforce, sometimes it's really hard to get to this type of result in record time. So that was really awesome. The other thing I liked is you can also see the graphic representation that you spent in really being able to identify from a visual perspective comprehensively on the Lightning page to be able to say, this is the user, here's the access that they have. And from a compliance perspective, that information needs to be readily available all the time for audit purposes. So thanks a lot for pulling all that stuff together in an easy way. Hopefully you're able to protect data leaks moving forward.
Absolutely.
Awesome.
Thanks, Josh.
Awesome. Amanda, what questions do we have out there for RevCult?
Yeah, it was a great demo. I liked how calm the Salesforce admin was. I felt like Devin, the admin, was very chill the whole time, which was great. And you would be, because you have great technology supporting you, right? The question is, how can RevCult help healthcare companies prepare for HIPAA and HIT trust audits?
Great question. So in addition to implementing the principle of least privilege access, which you saw here, RevCult solutions enable customers to implement, manage, improve other controls like data classification, encryption at rest, and field history tracking. RevCult arms customers with the evidence-based proof that they need to deliver compliance reports to InfoSec, audit, and ultimately satisfy the requirements for HIPAA and high trust. And as we all know, Salesforce is the most flexible and extensible platform in the world. So attaining some of the information around permissioning can be very manual and cumbersome. So we've automated a lot of that and make it much easier for our customers to get the reports that they need.
Awesome. Thank you very much for that demo. Jeff, are you going to bring us home? How many? Yep. I think you're going to bring us home.
We got one left. Devin saved the day, and he is pretty much the cool, calm admin that you need at the helm. I tell you what I've got next. I've got a couple of folks who, well, they seem to have won a hackathon, or at least they did a lot of really good stuff. Let me tell you about Invent 360. It was created in response to the early stages of the COVID-19 pandemic. DevPost was hosting a hackathon for ideas and tools that could solve some of the technical challenges that the world is now facing. A group of Salesforce employees came together and they designed and built a framework for managing DIY ventilators on Salesforce. It resulted in an application that's now been open sourced, which is cool in and of itself. But here's what we're going to do. We are going to bring in Steven Chandler Garcia and Charlie Isaacs to demo how this works. And I'm interested because this sounds crazy that you can do this, but I want to find out how it works. So Stefan, are you out there and ready? And Charlie, of course, too.
Yep. Yeah, I'm here, and I'm going to do the narration because I'll screw up the demo, and Stefan is going to actually run us through the demo. Ready to go?
Brilliant. Your 3 minutes begins now.
This Salesforce Labs app originated from a COVID-19 hackathon right at the beginning of the COVID-19 epidemic in the US, just as Jeff mentioned. when there was a worldwide shortage of ventilators, and you can see a picture of one of the ventilators on the right-hand side there, our goal was to allow it do-it-yourself tinkerer to build a ventilator and push those events directly into Salesforce. And the risk associated with a project like this is quality assurance, of course. So what we wanted to do was be able to monitor the ventilator, and you can see in this view that there's a model number, a status, age of operation, commission date, etc. But this view is very boring. Look at that tabular information at the bottom. But wait, there's more. Let's see the boring, non-boring view. Let's see readings from the ventilator in the ventilator dashboard. At a glance on the screen, you can see the line voltage and the current status, failed or okay. So if we click on the details of the ventilator, we can see that there are currently no alerts for this ventilator. Let's take a look at the voltage readings. Let's see, 120, 121, whatever it takes. And we can see they're all okay. But let's check out the oxygen volume now. That's great. The oxygen volume looks great. But what happens if Nurse Ratchet falls all over the, falls on top of the ventilator, and the ventilator starts failing? Uh-oh, the volumes are dropping below the threshold level. Oh my gosh. If you look up in the upper right-hand corner of the screen there, you can see some alerts coming in. And the ventilator faults have occurred. And of course, this is Salesforce. That's a clickable view. And I can go right into the cases in Service Cloud, Health Cloud. So we can see the subject and the description, and we can see that it's a critical issue. And if we click and look at the ventilator, we can see that it switched from in use to in service. Look at that. And now a field technician is going to be dispatched from Field Service Lightning. So when the service technician is dispatched by Salesforce Field Service Lightning, he removes the ventilator from service, removes Nurse Ratchet from the ventilator area, and the technician closes the case. So as soon as the technician closes the case, which he's going to do right here, it goes into the available state, and it could be reassigned to another patient at that point. So this is following the ventilator through the entire life cycle, as well as monitoring it on the fly. And then you can see it goes back into the in-use status. And let's go back into, and he's already there in the ventilator monitor. And you can see the ventilator is pushing a great oxygen level back to the patient. And everything now is hunky-dory. Thanks, Stefan, for saving that patient. Really appreciate it. And by the way, this is all built on Lightning Flow. Can you believe that? Lightning Flow and Lightning Web Components.
That is impressive stuff. I tell you, I was not expecting to see this kind of an interface in here. And when Charlie mentioned about the boring way of looking at the data, I'm like, come on, that's not actually that bad looking. But this does ratchet it up a notch without Nurse Ratchet at the helm. And the ability for you to be able to take all of those interactions and the data coming from the ventilator itself, coming into Salesforce, doing the alerts, immediately showing you the results of it, fantastic. So I can imagine that this was pretty necessary, as well as pretty impactful for those who were able to use it. Now being open sourced, anybody can go in there and continue to build upon it.
Yeah, and Stefan did an outstanding job of cleaning this up and getting it onto the Salesforce Labs. Amazing. Kudos to Stefan.
Yeah, absolutely, Stefan. Well, I'm going to turn it over to Amanda to see what kind of an audience question we have. Hopefully not about how to use a ventilator, because I don't know.
That was a great demo. I love the visualizations. It really brings the data to life. So awesome job there. The question is, can you use this with other medical equipment, or is it just for ventilators?
Yeah, since we're reading data from the outside world using platform events, you can trigger, now with the latest release of Salesforce Lightning Flow, you can push platform events directly into a Lightning Flow and launch it. And you could monitor not only health equipment, but anything else that needs to be monitored. Plus, we're doing a lot of COVID-19 use cases where we're pushing in thermal image scanners and medical equipment that doesn't even need to be monitored. We're just pushing the events directly into a flow and triggering workflows and activities directly in Work.com and Health Cloud.
Awesome stuff. Well, thank you so much for this demo. We have seen 6 awesome demos today. So, Amanda, what do we do next?
Well, I think it's time to vote. So we're going to show a slide, and that slide is going to have the voting link. You only have 24 hours to vote. So voting will end on September 18 at 1 o'clock Eastern. If you are not, if you're watching this after that date, you can still enjoy all the demos. Just watch all the links below and check out the demos there. So Joshua, are you showing the slides? I'll bring it up if you'd like.
We want everybody voting, so yes, we
Yeah, I
got to
think
see
we're
that.
just adding some suspense here.
Mm-hmm. Who's gonna win? There we go.
Okay, we're both presenting. All right, cool. So here is the voting link. Go ahead in and get your voting on so we can see who's the big winner. And any updates, Jeff and Joshua, while we're leaving the voting screen up for a moment?
I tell you what, what I miss about doing the in-person demo jams is that when we see these things happen, you know, in a live audience, you see our faces light up and we all go on video mute when the demoers are on. But when we see some of these things, you got to know that we're smiling because we're seeing some amazing functionality that we didn't even know existed. And that was definitely true with some of our contestants today. Same for you, Joshua?
Absolutely. I couldn't agree. The innovation that each one of these partners demonstrated today is how they're leveraging the platform to make admins' lives a lot easier is just unparalleled to anything that I've ever seen. So each demo jam, I'm like, ooh, that's amazing. Like, what to expect next? And these demo jam contestants and the others just continue to amaze us. So great job to everyone on the call.
We ought to start doing emoji responses in the middle of it, Amanda.
Yeah, I like using the little chat feature too, and we can all kind of connect while the demo jams are happening and ooh and ah together. And all of this wouldn't be possible without the AppExchange and amazing customers like you. Because of you, we have over 8 million installs, over 5,000 solutions, over 80,000 peer reviews. So go ahead to AppExchange and check out all of these apps. You can see them today at appdemojam.com. And then click through and go ahead and start those free trials and install into your sandbox. Test them out. That's all we've got for you. Thank you. And thank you, Jeff and Joshua. And thank you to all of our partners and participants today.
It was great to be here today. Everybody go out and vote. And if not, just go out and visit them on the AppExchange. And we look forward to seeing you next time. Bye-bye.
Bye-bye.